Live.
Greetings and welcome to a community conversation with panelists from various agencies and institutions. Tonight we're going to discuss the deadly truth, which is about opioid addiction. I am Lynette Allen, Fulton County Opioid Coordinator with Fulton County Department of Behavioral Health and Developmental Disabilities. So again, tonight we're talking about opioid addiction and recovery. So opioid addiction is devastating communities across our country right now. 40.3% of deaths in Georgia alone occur from synthetic opioid use, and prescription opioids are responsible for 50.8% of overdose deaths here in Georgia. Fulton County's Department of Behavioral Health and Developmental Disabilities has made a commitment to combat this epidemic by offering a full range of treatment and support services to residents of Fulton County. Especially those residents that are seeking programs and services that are geared towards recovery. Additional services, of course, include individual counseling, group counseling, discharge planning, and case management, as well as court attendance. We want to use our resources to support and serve those that are being impacted by opioid addiction. Tonight, before we get started with our panel discussion, Commissioner Liz Hausman, Fulton County Commissioner representing District 1 in Northeast Fulton, which includes the 4 cities east of Georgia 400, including Johns Creek, East Alpharetta, East Roswell, and Sandy Springs, will bring greetings and share her thoughts on the opioid crisis.
Greetings. I am Fulton County Vice Chair Liz Hausman, representing District 1, which includes the cities of Johns Creek, East Alpharetta, East Roswell, and the Panhandle of Sandy Springs. I want to thank you for joining tonight's broadcast, a community conversation, The Deadly Truth, to discuss a topic that I'm personally passionate about, opioid addiction, and specifically raising awareness of the deadly fentanyl-laced opioids. Opioid addiction is the 4th largest cause of death in our country, surpassed only by heart disease, cancer, and more recently, COVID-19. The death toll during the first 6 months of 2021 was an estimated 53,000 people, higher than any continuous 6-month period in 2020, and on pace for a new annual record by the end of this year. Fulton County Department of Behavioral Health and Developmental Disabilities has comprised a panel of subject matter experts for tonight's discussion, who will provide guidance to families of those individuals fighting opioid addiction. You will hear firsthand accounts from individuals in recovery, strategies for substance abuse prevention, and barrier-free ways to access treatment. The deadly truth is that opioid addiction is an epidemic destroying families and communities across this country. Let's work together to end this epidemic.
Okay, so before I introduce tonight's guest panelists, I'm going to give you the email address for which we like for you to send any questions. And this is, of course, for our viewing audience. Please direct any questions to fulton.communication@fultoncountyga.gov. Again, fulton.communications@fultoncountyga.gov. So, as we bring our panelists forward, let me introduce, I'm going to introduce each one, and then we would dive right into those questions. Joyce Mcclendon is a licensed clinical social worker, currently serving at Grady's Behavioral Health Adult Outpatient Clinic. For the past 7 years, Joyce has managed several specialty clinics, such as the Intake and Assessment Unit, Grady's Early Treatment Program for Young Adults, the Behavioral Health Call Center, community-based CM and ICM programs, and the medication-assisted outpatient treatment program. Our next panelist, Ms. Cheryl Deidel, was born and raised in St. Louis, Missouri, the youngest of three. She is the mother of three beautiful daughters, 11 grandchildren, and one great-grandson. Cheryl has resided in Atlanta for the past 40 years and is a Christian comedian that loves gospel music, family, and outdoors. Although retired, Cheryl spends a lot of time advocating for the opioid crisis. She regularly attends a program anonymously because it is her goal to help others that suffer from opioid addiction. Next, we have Ms. Beatrice King. Ms. King earned a Master of Science in Public Health from Tuskegee University in 2015. She has been a state of Georgia employee for 5 years, serving rural Georgia as a foster care case manager and epidemiologist before returning to Atlanta in August of 2021. She currently serves as an opioid public health analyst at the Fulton County Board of Health. She is currently using Syndromic Surveillance to identify neighborhoods in Fulton County that are experiencing the greatest burden of overdoses. And last but not least, our gentleman on the panel tonight is Mr. Curtis Dorsey. He has a Master's of Education, and there's a litany of other letters behind Mr. Dorsey's name that I won't read, but he's also a CARES. And he's also a person in long-term recovery, recovering from the disease of addiction. He is a graduate from the University of Arkansas, Pine Bluff, and holds a postgraduate degree from Lesley University in Cambridge, Massachusetts. As a master's prepared counseling educator with over 20 years experience in the helping profession, he specializes in addiction counseling with clinical and instructional supervision experience related to chemical, process, and behavioral addictions. That is our list of panelists tonight. So I think we're ready to start our questions. So for each of our panelists tonight, here's one question that we'll start out with everyone, and everyone will have a chance to answer. Please describe in detail your role in your current position as it relates to opioid addiction, substance use disorders, treatment, and recovery. So Ms. King, we'll go first with you, and I can read that question for you again. Please describe in detail your role in your current position as it relates to opioid addiction, substance use disorders, treatment, and recovery.
Okay, I am a public health analyst. And so in my role, I focus on empowering people who use drugs to make safer choices. We do improving partnerships with public safety and first responders. So currently, I am able to do training on overdose detection mapping application program. It's basically called ODMAP, and it is a system that law enforcement can use to see real-time data on overdoses that are occurring. We have that access here in Fulton County. It is split up by zip codes. The next thing we do is collect emergency room data on suspected drug overdoses. So we analyze that data to see where are the overdoses occurring and what drugs are involved. The next thing we do is strengthen prescription drug monitoring programs. That is managed by physicians that are prescribing opioids and pharmacists, just to make sure that individuals aren't receiving multiple prescriptions for opioids in a short amount of time. The next thing is just improving partnerships, going out to the community, finding those organizations that are doing work in substance use and supporting those organizations. The last thing that I'll mention is linkage to care to treatment. I've been working with recovery community organizations just to make sure that people get that linkage to care, not just for substance use disorder, but whatever needs that they have. So that's kind of what I do in a nutshell. And I also am housed in the Office of Emergency Preparedness at Fulton County Board of Health. So I have a whole other side of my job as well.
Thank you, Beatrice. And the next person we will ask that question to is Mr. Dorsey.
Thank you. Hello and good evening. So my role before the pandemic, I did a dual role, but worked in the post-overdose program at Grady's ER. And in that role, what we did as a peer specialist, once an individual came in with an overdose, once the medical people did the things that they would do to bring that person back, then the next person they would encounter would be myself or my colleague. We would then introduce them to solutions to drug use, such as treatment, our MOAT program located at 10 Park Place. And due to the pandemic, that program was put on hold until after the pandemic. So currently, I am a member of the Grady Act team. I serve as a substance abuse counselor for them, where we go out into the community and meet our clients and helping them to overcome some of the challenges that they're having with the disease of addiction. So it's a tough job, but very enjoyable when we're helping others.
Okay, thank you. Ms. Deidel, can you tell us what your role is?
Yes, good evening, everyone. My role is I am a member of an anonymous program, and I basically focus on the newcomer. And the newcomer is the people that are coming in off the streets or wherever they're coming from, and they suffer with opioid addiction. I also have, well, I don't have, but I also do a lot in the community as far as I go into the neighborhoods, you know, and I talk to the young guys who are literally selling opioids, you know, trying to discourage them. You know, I talk to those that are addicted to the opioids, just advocating, advocating.
Thank you. And Ms. Mcclendon, you're on mute.
Let's do that again.
Okay.
Thank you. It's good to be here. So I am the program manager at our Grady Behavioral Health MOAT program. And we work very closely with our clinical decision unit at Main Grady in the ER, which captures a lot of individuals who overdose and, you know, are taken there. They are routed to our program, where we ensure that they get their intake. Let me back up. Our attendings work in the CDU, so they manage our program at 10 Park Place in the MOAT clinic. And so we make sure that they get started in the program once they get inducted or induced at the CDU. Most all patients connect with us. We have a few that aren't necessarily ready for treatment, and so they don't come, but we do extend outreach. You know, we'll call and we'll try to follow up with them. And I work with an amazing group of professionals. You know, we have a collaborative relationship with Emory and Morehouse, who serve as our attendants and residents, who also provide treatment services in the program, and as well as clinical social workers and licensed licensed professional counselors. And so we also have a CPS and CARES that works in the program, who provides their shared and lived experience with our patients, which I think goes a long way with our client population. I think it's really good for them to see someone that's walked in their shoes and to see where they can end up, you know, at the end of their treatment. So we extend a myriad of services. We provide individual therapy, group services, and, you know, provide whatever individualized treatment and care our patients need once they come in the door.
Okay, thank you so very much. So now we're going to talk a little bit more. We're going to move into some really specifics. So Ms. King, again, you are up next, but of course these questions are open and anyone can chime in, but these are your specific questions for now. Please define syndromic surveillance and how it's used when talking about suspected overdoses for our audience, for those of us who don't know what syndromic surveillance is.
Okay, so syndromic surveillance is a term used by epidemiologists. And the best way to describe it is that emergency departments collect data every day and they report it to the Department of Public Health. And this data is labeled by what the chief complaint is. So what's the main reason that person presented to the emergency department? So we have a drug surveillance unit that can search that data for the words drug overdose. They're looking for unusually high numbers of overdoses that are occurring. And we are looking for things like overdoses caused by the same drug, overdoses that occur in the same time, space, contact, and cause. So just some examples of time. There's been times where within 24 hours, I had about multiple overdoses within a 2-mile radius. It was actually in the area over by the AUC. Another time where we've had another example is currently Savannah, Georgia is experiencing overdoses linked to blue oxy pill that's laced with fentanyl. So that's an example of a cluster related to a specific cause. There's also a powdered substance that's circulating around where it's cocaine mixed with fentanyl. And so we know that's very deadly because a lot of times you cannot look at cocaine until that fentanyl is mixed in, because fentanyl is such a small and granular. So that mixture is called cream. I also work with several individuals from different areas. So I work with first responders, that's fire, EMS, pharmacists, hospitals, epidemiologists, the coroner, recovery community organizations, law enforcement. I have contacts in the city, the county, GBI, and also on the federal level. And then also with treatment and recovery organizations. So it's literally an investigation is launched once I identify a cluster of suspect opioids and I contact all of these individuals. I send them letters and just ask for additional information. And I've gotten a lot of information about drugs, like the historic use of drugs in Atlanta. So I've learned a lot just in my short time in my role. So thank you.
Okay, thank you. In 2020 and in 2021, there was an increase of the number of overdoses across the country and here in Georgia. Can you explain for us now what some of those current trends look like?
So we know that there is an overdose or opioid epidemic going on in the United States. Within the last year, we had over 100,000 deaths due to opioids. As far as Fulton County, we experienced 335 deaths in an 18-month period. This is stretching between February 2020 and June 2021. During that same time period, the state of Georgia experienced 2,907 overdose deaths, and that made up 11.5% of the state's overdose deaths. I will say that I've been in my current role for 6 months. For the entire 6 months, Fulton County has had the highest amount of drug-related overdoses for the state of Georgia. The drug surveillance unit puts out a map every week of all of the counties in Georgia, and ours never really changes. We always have, as far as having the most burden, we have the highest amount. And we also know that we have the most people in Fulton County. We have over 1 million residents. The other thing that I wanted to address is just the connectedness of Fulton County. You know, we have a major airport, international airport. We also have drug trafficking that is occurring in our transportation system along those interstates. And we also have a lot of fentanyl coming in. I think I'm kind of going over into my next question, Ms. Lynette. But all of those, you know, the drugs are coming in that way. And then we also have communities like the Bluff that are just really endemic to drug use. So that's another thing that we need to address.
Absolutely. Thank you so much, Beatrice. And of course, you did say you were going over into your next question. So we can talk about it now.
Okay.
So we hear a lot about fentanyl and how deadly it is. Based upon your knowledge, what do you think can be done to curb this epidemic?
Okay, so I have several ideas. Just going to go through a few. One is really addressing the stigma related to substance use disorder. I congratulate everyone who's in recovery and who are doing the work and really sharing their stories. More of that is needed. I'm working to create a media campaign just to get more information out about substance use disorder, treatments that are available, connect people to recovery community organizations. The Georgia Council on Substance Abuse, they are supporting recovery community organizations. I've had the privilege to go out and visit some organizations. One in Sandy Springs is called Peers Empowering Peers. They have activities and arts and crafts, and they serve a lot of women who are in inpatient treatment, and they're able to come to their location just for activities. And they're also able to receive linkage to care services. So this can include daycare, housing, just everything that they need to make the transition out of inpatient treatment back into the community. Another organization that I enjoy working with is called Rise to Recovery Theater. They're located in the West End. They do a lot of arts and crafts, fine arts, dancing, painting, drumming, and all of it is related to helping people with their process to recovery and also improving mental health. The next thing that I've really proud of is I've been able to support law enforcement and first responders with receiving funding and training for naloxone, so they can get the training on how to use the kits and then actually receive some kits. And so this is a drug that's used to reverse the effects of a drug overdose. And so it can be a nasal spray or an IV injection. And so that is what saves lives. And we need more of it out in the community when we're experiencing such a high level of drug overdoses.
Thank you very much. And I'm sure we will come back to you.
Yes, ma'am.
So, Mr. Dorsey, you're up next on the hot seat. As an overdose survivor and peer support specialist, what is the most important message or messages for you to give to others that have overdosed or are struggling in their journeys to recovery? How has recovery changed your life?
Well, here again, the message is pretty simple that I share with individuals. When I worked in the post-overdose program at Grady ER, I lost 3 individuals. And it's always tough to lose someone. And even when I share about it, well up because I lost individuals before they had the opportunity to recover. So the message that I share with them is that for those that are brought back, they are given another chance. And I let them know that they're given another chance. So they're given that chance at a new life, to live life more abundantly. So I let them know that through their higher power, whatever they want to call it, that they've been given that chance, and perhaps given lots and lots of chances, right? I've been given a lot of chances in my life. The issue is we never know when it'll be our last chance.
Mhm.
So why take the chance?
Right.
That's the message I share with them.
Okay.
So recovery has changed my life tremendously. As you shared, I enjoy learning. And based upon the letters behind my name, people can see that. And it has given me the opportunity to learn how to live, and given me the opportunity to share with others how to live rather than survive, and that there is help. So why not take the help?
Okay. And can you tell us what were the issues that caused you to become involved with drugs in the first place?
So, it's complex, but to try to sum it up, I grew up on the south side of Chicago, and not in the same area as Michelle Obama, but
Mhm.
on the south side of Chicago. And in the area that I grew up in, the culture, alcohol and drugs was part of the culture. Even when I gravitated to college, I gravitated toward fraternities, a fraternity that the culture was alcohol and drugs. So, of course, it was fun based. It was about enjoyment. It was about letting go of problems. It was about low self esteem, fear, insecurity, all those things that a person is trying to rid themselves of. And no one starts out by saying that I'm going to be an alcoholic, but the culture is fun, games, and I'm relaxing myself, right? Individuals go home from a hard day's work and they have a glass of wine. I just happen to have 4 or 5 glasses. And then the addiction sat in. And once the addiction sat in, then it becomes no fun. It becomes a job. And I have to satisfy that craving. I have to satisfy that obsession. I have to satisfy that compulsion. And with all those three things piled upon you, it becomes very difficult to stop. So you need help. You need someone who knows how to stop, someone who has been in that abyss and knows how to get out. And today, I'm that individual.
Awesome. So I'm gonna move over to Ms. Cheryl Deidel for a minute. And of course, this is an open conversation. So, if there's a compelling question that you'd like to answer, please just let us know. Ms. Deidel, what led you to finally begin your journey to recovery, and how has the recovery changed your life?
Wow. Well, what led me was I got sick and tired of being sick and tired. And I came to the end of my road. At the end of my road, it was horrible. It was horrible. I think I grew up in a home where we were told that whatever goes on in our house stays in our house. There was some molestation. There were a lot of secrets, rape, just a lot of stuff. And the drugs helped cover up the pain. It helped cover up the pain. I was afraid. I didn't want to talk about it.
Mm-hmm.
And I was told sometimes that, if I did, that I would be hurt physically. And so I resorted to the drugs. And the community, I grew up in the inner city, and it was just a way of life for everybody.
Mhm.
Everybody used something, whether it was marijuana, pills, quaaludes, wine, everybody used. And I think a lot of it was, trying to fit in, wanting to be a part of something, wanting to be loved, And all that led me down that road to my addiction.
Okay.
Yes.
So when you're assisting others with their journey into recovery, what are some of the most valuable ways that you think we can help?
Well, the first thing I tell a person is that if you don't pick it up, you can't get high. First of all.
Mhm.
And I come to learn that any addict can stop using drugs, lose the desire to use, and find a new way to live. But you gotta have a desire. You got to have the desire. Recovery is for people who want it, because there's a lot of folk who need it.
Mhm.
There's a lot of folk who need it, but it's for people who want it. And I believe wholeheartedly in the 12 steps. They're a part of my 12 steps is my life.
Mhm.
It's my life. I always tell people that addiction, you have to find out who you are. And let me just talk about me. I had to find out who I was, because for many years I walked around pretending as if I was someone else.
Mhm.
And it was an anonymous program. That even though I went to treatment and I learned a lot of things in treatment about myself, I found out that I was living in a house with a guy who he had been molesting my little girls, and I didn't believe them. It wasn't until I went to treatment and I actually found out that he was actually doing that. Because I don't know if anybody ever had the experience, but we have some sisters who it's whatever the brothers say. We don't believe what the children say. But I'm here to tell you that if anybody out there is listening and looking, pay attention to your children. Listen to them. Because if my mother, and I'm not blaming her for anything, especially my addiction, because I did have the power of choice, and I chose to use. But I'm just saying, we got some of our kids who, 12 and 13 years old using drugs because, they don't get the opportunity to talk to the parents. People are not listening. We got to listen, and we got to pay attention, to what's going on, especially in the home. I don't know. I just know that the 12 steps saved my life. They saved my life. I live it. I breathe it. 12 steps.
Awesome. Thank you so much for sharing. And definitely we want to come back to you, but we also want to ask some questions of Ms. Mcclendon. So Joyce, we understand that medication-assisted treatment is a valuable tool for some as it relates to recovery. What are some reasons why people refuse the treatment?
So some of the things that we've seen is that there's definitely a lack of education about what medication-assisted treatment is. There's a fear of side effects. They worry about, oh, what is this going to do to me? Some patients don't like the frequency of visits that they have to attend early on. They have to have several visits to see the doctor. They need to be in group counseling services. They have to see their individual therapist, and many of them want to come get their medication and go home. And that's not what our program is. And, medication alone can't provide the necessary tools that this population needs to get better. It helps, but the recovery tools that the counselors and the CPS cares provide are the lifelong tools that they will have moving forward. So we really, really try to stress and emphasize that they, attend a comprehensive treatment program. They also don't like taking Suboxone because they can no longer use opioids or drink alcohol, because of course, drinking alcohol increases the overdose effect of using opioids. So they don't like that. And of course, early on in treatment, there's going to be some relapse potentially. That's a part of recovery. But we try to encourage them to take the medication, come to groups, do their individual therapy, and oftentimes, and the other caveat is making, if they have family involvement or natural support, social supports, we encourage them to have them involved in their care as well, because that also is a great support for our patients. And then I think there are also the self-imposed barriers that patients put upon themselves, because there's a lot of negative talk in the community on the websites, et cetera, that talks about why you shouldn't take, medication-assisted treatment. There's a myth that if you're taking Suboxone, you're not clean, you're not in recovery. And so, overcoming all of that. And then there's some shame associated with that. Some patients don't want to be on medication. They don't feel like they should have to take a medication to get off of a medication. And so we attempt to provide education in regards to what the facts are, and, move forward with them in that way. And oftentimes it catches, after a while, they get it. They understand the importance of participation in their clinical treatment, and it benefits them in the long run.
Awesome. What messages do you all give to support those that do receive medication-assisted treatment? And is there an impact on the number of relapses?
So I would say one of the messages that we try to give is that medication-assisted treatment is a life-saving treatment. To Ms. King's point, there has been a lot of deaths, across the nation in regards to opioid use. And so we try to encourage them to, make sure that they are participating in their individualized treatment approach that we provide for them. We make sure that if they have family, connecting them with family, if they've burnt bridges, trying to reunite and repair those damages that have been done over the years with family members. And so what I found is that if they are participating in their recovery, if they are reconnected with the people that mean the most to them, there is some relapse, don't get me wrong, but I think what I've seen is that there's the likelihood that they have a better chance of long-term recovery when they have those outside supports outside of the clinic. And so that really goes a long way.
Okay. And one more question for you. Actually, this is a question and anyone can chime in. I know Ms. King has already answered it. Again, we hear a lot about fentanyl and how deadly it is. And based upon your knowledge, what can be done to curb the epidemic?
I think educating our communities more about what fentanyl is, making sure, to Ms. King's point, ensuring that naloxone is available to individuals in the community, because it can definitely rapidly reverse an opioid overdose. So ensuring that, there's education about how to use that, making sure that it's out there so that individuals have access to it. Ensuring that the community at large is aware of the services that's available to them, knowing where to go, knowing who to call, who to reach out to if they have a loved one, or if it's them themselves who need treatment or treatment options. Intervening early with individuals is important, educating them about the dangers of what fentanyl is and so forth. So I think just a broad community approach is needed to ensure that individuals are educated about what this epidemic is and how we can help combat it.
Okay. Mr. Dorsey, did you want to comment on that as well?
Sure, and I definitely agree with Ms. Mcclendon. So the education piece is very important, is to get that message out to individuals, definitely to get the message out of how to use Narcan, either the injection or the spray. We have to get that into the community. I am a confirmed believer of harm reduction programs that work out there. We need those things, but the educational piece is perhaps the most powerful tool that we can use with individuals that are caught up in the grips of addiction when it comes to opioids and being laced with fentanyl. And we need to understand that they're also putting fentanyl and other things such as marijuana. So we have to be real careful to let individuals know now that the dealers are doing these things, one, to get you addicted faster. And the faster they get you addicted, then of course, the more times you'll come back with your money, because it's money involved for them. So the education piece is important.
Absolutely.
And if I might add, Lynette, I would say healthcare providers, I think we all need to educate patients more, whether it's primary care, whatever the healthcare setting, educating patients and trying to dispel the myths associated with medication-assisted treatment. I think that would definitely go a long way, overall.
Okay. And I think we have
just a quick comment, and here again, agreeing with Ms. Joyce concerning the medication-assisted treatment. So there's a lot of individuals that we have to understand that come through a 12-step program, and so do I, that believe that the medicated assisted treatment may not be the way. However, we have to take a clinical look at it. So the 12-step programs have worked for a countless number of people, and we can't count them. But we have to understand that if a person is on methadone, for example, it's probably better for them to be on methadone than to be on street drugs, where they may be committing crimes in order to get those drugs. So there is that harm reduction piece that's important for us to understand. And we have to understand that there's many pathways to this recovery process.
All right. Thank you all so very much. We're going to wrap up this section, and now we're going to go into our Q&A. So, Ms. Roberson, do you have any questions for our panelists tonight?
Yes, the first question is, how deadly is fentanyl? Can someone die from simply touching a person that has overdosed on fentanyl?
Does anyone want to take that question?
So they want to know if they can die if they touch someone.
If a person is if a person is overdosed, they want to know if they touch that person to assist them. Can they also die? How deadly is it? I guess they've experienced that before.
Oh, okay. My understanding, unless they've used fentanyl, that's the only way that it can kill you. If they're touching someone who is, ODing, no, they're not going to die from that.
Okay.
Yeah, so real quick, here again, just to add on to that. And if we take a look at that the same way we looked at the HIV/AIDS epidemic in the 80s, when people didn't want to touch people because they thought they would get it. The same way with fentanyl. I mean, if someone is ODing from fentanyl, if you touch them, you're not going to OD. So we have to look at it from that angle. And of course, the education has evolved where we know that we can hug people and now since the evolution.
All right, next question is, prescription drugs are monitored by physicians and pharmacies. So how are folks getting access to controlled substances in our communities?
Well, I would like to speak. Oh, sorry. Go ahead, Ms. Dowdy.
From what little I know, I believe that they're coming in from other countries. I honestly do. I think they're being transported here from other places. I honestly do. We still have those cartels transporting drugs, and people are bringing drugs across state lines. I mean, come on, y'all. It's just happening all the time. It's not only here in our community, it's everywhere. It's everywhere. So we know that they got to be coming from somewhere, and they not falling from the sky. That's for sure. But I just believe that they're being transported in here from other countries.
All right, we have a question directed to Mr. Dorsey. What was the defining event that made you choose to begin recovery? And also, what challenges have you faced in sobriety?
So first of all, the challenges of sobriety is what we call a one day at a time thing. So I still take life one day at a time, and I enjoy the day that I'm in, and I'm enjoying today. What was the first part of the question? I'm caught up on enjoying life.
They asked, what was the defining event that made you choose to begin recovery, and also what challenges have you faced in sobriety?
Okay. So here again, the challenges is the way I look at it is to keep things simple, and small things are small things unless they're life threatening. Look, that whole piece with getting caught up in that abyss, and everyone reaches a bottom and you never know where that bottom is. I was an individual, I didn't go to treatment. I went to a psychiatric hospital because I was at the point of contemplating suicidal ideation. So I had the psychiatrist assure me that I wasn't crazy. I just needed to stop doing what I was doing. And but something had to give, and that's what happens with most individuals. They get to a point where something has to give.
And I'd like to say something to piggyback off of that. For me, my challenges are just living life on life's terms. Just everyday living. Simple things, paying the mortgage, paying the light bill. Because when I was using, I didn't pay anybody. I didn't pay any bills. I didn't cook dinner for my children. I didn't do anything for my grandchildren. So we call it living life on life's terms. And if I don't stay on top of my spiritual maintenance, then I'm subject to screw up somewhere down the line.
All right. We have a question directed towards from Ms. Beatrice King. How can an organization get involved with educating our community? Also, how can we get the overdose reversal kits?
Okay, for the first question about getting involved, I would say seek out those organizations in your community that are already doing the work and related to substance use. We have recovery community organizations. They are supported by the Georgia Council on Substance Abuse. We also have Atlanta Harm Reduction Coalition that's in Atlanta. They also provide Narcan, so that is a good resource. They also do syringe. They have a syringe services program, Linkage to Care. Another organization is called ANEES. They do some harm reduction in Atlanta as well. And I'm going to, in the chat, actually put in the website where you can go and get more information on the naloxone. Also know that everyone can go to a pharmacy and receive naloxone. There's a standing order, so you could just walk up to a pharmacy and ask for naloxone, and there is a fee for it, but it is available that way as well.
Okay. There's another question for you, Ms. Beatrice. Why is the distribution and use of opioids so high in the blood?
Okay, so I had to do some cultural investigations. If you all are interested, Google, YouTube, Netflix, there's a video called Snow in the Bluff. It's actually like a movie, and you get to hear people who have lived in the Bluff a long time talk about it. I've learned that rappers go to the Bluff to make music videos. They pay the people in the Bluff to be able to, have access to that space. The Bluff is notoriously known for heroin. And so that is a place where people go to receive heroin. I've been out to the Bluff several times. Back in October, we had someone overdose in the park there. And so I went out as far as an outreach, and I attended the John P. Garner walk and just gave out information about opioids. We also have, Fulton County also has a health center in the Bluff. It's kind of, tucked away on one of the side streets. But that's a health center that people can use, get services there. Also, there's like a lot of dilapidated housing there. There's been an issue with we also know like the stadiums, it's really in like the backyard of the major stadiums in Atlanta, the backyard of the AUC. And so I just found out that Arthur Blank Foundation is supporting a organization to address the problems in the Bluff, but from my understanding, it's just been a long-standing issue. And as far as law enforcement, we also know that a lot of law enforcement nationwide is understaffed. And so that's an issue as well, where, law enforcement may not be actually, prosecuting the people who are responsible for drug trafficking. So it's really like a deep dive, really. It's not just one answer as to why there is an issue, but we all need to work together as a community to really change the culture of the Bluff, get to know those people on a personal level and meet their needs. And the commissioner in that area, I think her name is Natalie Hall. She's doing a lot of great work in the Bluff. She did a community cleanup. She hosted the John P. Garner Walk. She's also been giving away food. So she's doing amazing work. And I encourage you all to connect with her and help her rebuild that community.
Okay, I have a general question for all of the panelists. I feel that people that struggle with drug use are looked at as nasty or looked over. How can we better advocate for those people and overcome the stigma? And how do opioids affect the structure of the human brain? So they send a two-part question.
Can you do the first part again? I'm sorry.
I feel that people that struggle with drug use are looked at as nasty or looked over. How can we better advocate for those people and overcome this stigma? And the second part of that question is, how do opioids affect the structure of the human brain?
Well, I'd like to answer the first part of that question. And my answer to that is, we can kill that stigma that once an addict, always an addict. Because all you got to do is Look at me. I am the example. You know, I am the example that, you know, if you got the willingness, you know, and you're ready to stop using, oh, it can happen. It can definitely happen.
And I would like to add, I think people perceive addiction as a moral deficit, and that's not the case. You know, when I provide education, I try to make sure that individuals know that addiction is no different from someone who may have hypertension or diabetes. You know, they need help and they need treatment. And I think that there's this juxtapose of individuals wanting to look at that situation as, well, they impose that on themselves. Also not the case. So I think, again, it just goes back to educating people. You know, I think there's a lot of judgment that is, you know, turned towards individuals who use. And, you know, I think just us changing the narrative as healthcare professionals would go a long way. And we do that, but, you know, it's going to take a lot more because it does not appear to be changing. You know, individuals are stuck in that this is more of a moral issue and people have a choice. They chose to use and all the things that go along with that. And you know, that's not the case.
I had one other thing I wanted to throw in there, say, and what a lot of people don't want to talk about, and I found this out just being in recovery, is mental health. Mental health, it plays a great part, a big part, you know, in addiction. And what I've come to realize is that until I was able to deal with the mental health piece, I couldn't get the recovery piece. I had to deal with my mental health first and then move on to recovery.
And I'll chime in. Obviously, everything spoken was right on. And what we fail to remember is that the disease of addiction affects people from all walks of life. So individuals that are millionaires struggle with addiction. Individuals, we take a look at the entertainment industry, they struggle with addiction. The difference is that they can hide their addiction in their multi-level homes, or they are out in an area where we don't see them. And as Cheryl stated, when it comes to mental illness and homelessness, that's what a lot of people see, and that's what they attribute to addiction. But keep in mind that the people that are ODing in some of these places that we don't think they're using drugs is happening at the same level as those that we see perhaps that are homeless. And the second part of the question, when it comes to the brain, it's like any other part of addiction. And I do process addictions as well. So once the frontal cortex has been hijacked, it makes no difference, right? Because you can't make a good analytical decision. And research has shown that a person that uses cocaine and a person that has a gambling addiction, the same part of the brain lights up with excitement. And that becomes the key. And that's why this is a brain disease, because the study shows that with process addictions and substance addictions, once that prefrontal cortex has been hijacked, the sensation for whatever they're struggling with lights up in the same areas of the brain.
Thank you all so very much. This time has gone by really fast, but they're telling us that we really have to wrap up. So I just want to say thank you all. And maybe at some point we can do a second part of this conversation, because it's truly been enlightening and we have lots of great questions. Unfortunately, we cannot get to all of them, but hopefully at another time. So again, we want to say thank you for joining us. As a result of COVID-19, Fulton County Department of Behavioral Health and Developmental Disabilities is currently operating a hybrid service model, which we call our telehealth. And telehealth services are available through the department Monday through Friday from 8:30 to 5. If anyone would like to make an in-clinic or a telehealth appointment at any of our locations, please feel free to give us a call at 404-730-9626. And of course, to access our online services, please visit us again at www.fultoncountyga.gov. As a final thought, and I know it's already 7:30, Afrika, do we have time for each panelist to give us one word about addiction? Just one word, panelists, and we will let you all go.
I'll go. Oh, I'll go first. One thing that I didn't get to say was about the counterfeit drugs that are coming in. So there was a question about how are people getting opioids? There's a lot of counterfeit drugs. There's a lot of pills that are being made. And then there's also drugs being given to children. And these children may be receiving drugs unknowingly. So one way that addiction is occurring is that people are being kind of tricked into using drugs. Their drugs are being laced, and then it creates an addiction.
Absolutely.
My word is, oh, I'm sorry.
Oh, go ahead.
I was going to say my word would be love, because, behind, as Ms. Deidel stated, there's a lot of trauma that is underlying individuals with addiction. And, loving them in spite of is the thing I think that they need most.
Okay. Ms. Deidel?
My word is compassion. We've got to start having a little bit more compassion for, people who are addicted. They're not throwaways. They're human beings also. They have wants, needs, and just like Curtis said, we got people, oh my God, I go to meetings with people that got all kind of letters behind their names. I'm talking about preachers, teachers, doctors, lawyers, addicted. So we got to have some compassion.
Thank you. And Mr. Dorsey, one word to sum it up.
2 words. The opposite of addiction is connection. We need to connect.
Absolutely. Well, again, thank you all so very much. And please don't ignore my phone calls and my emails, because I'll be calling you back again so we can do part 2. I hope everyone has a great night.
Thank you. This was awesome.
Thank you. It was.
Yeah, this was awesome.
Thank you all so very much.
Good night, everybody.
Good night.
Good night. Thanks for coming.